So going through certifications, so with chiropractic, when you graduate, you become a doctor of chiropractic, and then it's up to you to take that in your knowledge to further expand on it. So our expansion would be more in the realm of family practice, so working with prenatal care, and then prenatal, postnatal, and then also working with pediatrics. Yeah. So we see a high volume of families that come in, and so Webster technique is one of them, is getting further educated on the Webster technique. And then our continuing ed, I try to find more diverse classes to where I can go learn and get well equipped with different situations that I see come into the office. A big one that we do is also CBP. So chiropractic biophysics is our whole office philosophy, which is the structure equals the function. So it's a technique that is very detailed and very sequenced. So as far as the care that you're going to get in one office is going to be very similar to another office that's practicing CBP. And that comes down to mirror image adjusting, mirror image exercises. It's just not a technique that sits within the four walls of movement chiropractic. It's also a technique that will go and translate outside of here. Right. And there's tools that they can use at home, because taking care of your spine is a 7-day-a-week job, especially when somebody comes in with a problem. Yeah. Yeah, I would say we're not a specialist at any one thing. We're kind of more of a jack of all trades office, which allows us to see a good amount of people, and then also know when we have to refer out in some other like special cases. As far as chiropractic goes, Dr. Bryan kind of hit it. So Webster's technique, and then pediatrics, and then we also do see a good amount of athletes. I know both of our background comes from more athletics. So outside of chiropractic, and you can speak on yours as well, but I have a background in coaching and massage therapy. So I love to work with not necessarily just athletes, but those that like to incorporate some sort of fitness or activities into their lifestyle. So that's just because that's kind of my inherent background for the last decade and a half. And then with massage and Eastern medicine, so Oriental medicine, that kind of stuff, applied kinesiology, I like to kind of add in some soft tissue realm like that. However, in our office, yeah, with chiropractic, the adjustment's the number one thing that we focus on, because we know the impact that that can have on a lot of our patients. But I would say that, yeah, we do a good job of well-equipped. Yeah, and we're always looking, we do continuing education every year, and we're always looking for seminars and stuff like that to help improve not only the skills that we currently have, but new ones that, you know, we see that have come into the office or have just, you know, we want to learn. And being well-equipped, as well as having a plan, is the best way to get an outcome.